Hi there, Dr. Tansavatdi here. So this is a video on the informed consent process for your upcoming CO2 laser resurfacing procedure. There is a separate video that goes over general risks from any type of procedure, and that's a separate video that I outlined general risks of all types of procedures. Specifically in this video, I'm going to go over just CO2 laser resurfacing. This also applies to dermabrasion as well as chemical peel. So I'm going to talk about all three procedures in this video for the consent. First thing that I want to point out is that the informed consent process is meant to give you information about the procedure so that you're educated prior to the procedure and informed about what to expect, what are the potential complications that can happen, and what are potential things that can occur during the healing process as well that are more normal. Okay, so let me give you a little bit information about lasers and chemical peels and dermabrasion. Dermabrasion is a procedure that is meant to resurface the skin with a surgical tool. It's a abrader, so it will rip the surface of the skin, the layers of the skin, down to the layers that we want, which is the layers where the dermis starts, and that's where the new skin grows up from. If you think about the difference between aerating a lawn, like your grass, and ripping all the grass out but leaving just the seedlings in the dirt. So that's the difference between a fractional CO2 laser resurfacing and a full blade of resurfacing versus a dermabrasion. So dermabrasion is very similar to a full CO2 laser resurfacing. And oftentimes I'm doing a combination with a fractional combined with the full effect. So in that sense, you will see that the downtime is going to be longer for these more aggressive procedures, and some of the risks include prolonged redness, swelling, and other things. So I'll go over that. But I'm trying to describe to you what are the difference between these two procedures. Then a chemical peel is really where the peel is applied, and chemically it is going into the layers of the skin and breaking apart the cells, and that will then cause those layers to fall off in the future. Chemical peels are less aggressive. They can be aggressive, but the ones that I do are typically what we call moderate depth. So they are not as aggressive as a CO2 laser or a dermabrasion procedure. So the risks between these procedures are going to apply differently. So I'll go over that later. So alternatives to these procedures would be microneedling. That's a very surface-oriented, we're not peeling away surface layers of the skin. We're injuring or traumatizing, somewhat similar to a fractional laser, but we're doing it with needles, and we are not ripping the surface of the skin, so it is protected still. And then you may have a little shedding of skin, but that's just the superficial dead surface layers. That's microneedling. Another option that you have besides microneedling is microdermabrasion, and then another option besides that is something called fractura or fractional RF resurfacing, where we're putting needles in and then delivering heat energy to kind of stimulate the growth of new skin cells and collagen in the area. Not quite the same as what we're doing with the CO2 laser resurfacing, dermabrasion, or a chemical peel. And then again, an alternative to a CO2 laser would be chemical peel or the dermabrasion, depending on the area that we're choosing to treat. Dermabrasion is more difficult to do for the whole face. I will typically use it for certain areas such as around the upper lip and around the mouth or a certain scar. So those are the differences there. The inherent risks of the procedures of chemical peel, laser resurfacing, and dermabrasion are going to be outlined now as I go over this. I will not go over the general risks of all types of procedures. So let me start off with the first one, which is infection. Infection, there's two types. There's a bacterial infection and a viral infection. Bacterial infections are not very common at all. And one of the reasons why is we have you on an antibiotic going into the procedure. You are keeping your face clean by doing the dilute vinegar soaks, so that avoids a lot of the bacterial infections. So it's very rare to see that. Viral infections are more common. Again, not as common as, it's not the most common risk or complication that can occur, but it's something to be aware about. We are going to put you on an antiviral medication, and you're going to be taking this for about 1 week, starting 2 days before the procedure, and you're going to continue until it's done. Occasionally, people will still have a blister that can develop after, despite being on the antiviral medication. The way you will know, though, it's not going to show up like a normal cold blister around the mouth or around the eyes. It's not going to show up that way. It's going to show up with burning sensation in an area that is not healing as fast as another area. If that's the case, that's when we need to bump up the dose of your antiviral medication. And so if you do have any of those symptoms, if you have a burning sensation outside of the first day, that burning will show up day 5, day 6, day 7, somewhere further along, and you're getting that, as well as it's an area that's healing slower, then that's something to let us know about, because we'll want to increase the dose of the antiviral medication. If it's not treated appropriately, it can lead to scarring, and that's one of the other possible risks of the CO2 laser procedure is scarring. Burns. So the next one on the list says burns. That is that laser resurfacing is a controlled burn, but if it's left unchecked because you're not following the instructions on applying the ointment, the Aquaphor ointment, to make sure everything stays moist. You have a nice thick layer on everything. If you don't and it does dry out, or you rub your face at night and peel away some of the skin, it can lead to scarring. So those are the things you want to avoid, is to avoid having the skin dry out, having to avoid having the skin peel before it's ready, because that can lead to scarring. The next thing to know about is color change. This is one of the more common complications that can occur after a CO2 laser resurfacing procedure. So it is the most common, should I say, is hyperpigmentation. That means the pigment in your skin gets darker in certain areas. That is more common than anything else that I see, and it is temporary. So a lot of people worry about it, that it's permanent. It's not permanent. As long as we have analyzed your skin beforehand, the risk of having permanent hyperpigmentation is low, unless you have previous history of melasma. Then those are the patients where I avoid doing the CO2 laser altogether. But if you don't have any history of melasma, then the hyperpigmentation is typically short-lived, and it's called post-inflammatory hyperpigmentation. So what we need to do is decrease the inflammation. So we typically put you on a cream like hydrocortisone cream or hydrocortisone lotion, or sometimes even Retin-A combined with hydroquinone, which is something that decreases the amount of pigment production and will treat that hyperpigmentation. So again, that's short-lived. The other thing to know about is redness. That's another potential risk, prolonged redness. Redness can last anywhere from a month to 6 months, or even up to 9 months to a year. And that redness will keep fading along as you go. But what might linger is that there are times maybe when you go to shower, work out, where you see that the redness picks up again, and you look in the mirror and you've got some flushed cheeks. That's very normal to happen even many months out from the procedure itself. But at rest, you should not see a deep redness in your skin. So that should be gone. But the redness can take a while, and it may last different among each person. I do see less redness with dermabrasion and less redness with a chemical peel. So those are things to know with the difference between that. Laser resurfacing tends to take longer with the redness. If you do use Accutane, you will want to stop that. We will not do a CO2 laser if you've previously used Accutane at least 6 months before the procedure. So you have to stop at least 6 months before this procedure. Skin tissue pathology. This means that if you do have any skin cancer, anything that looks suspicious, we'll want to get that treated before we do the laser treatment, because the laser will not be the cure for skin cancer, and that needs to be surgically removed either through Mohs resection or through surgical skin cancer removal. All right, visible skin patterns. This is something that I have seen in the past, and this can occur. This is because when we do laser resurfacing, this is not true with dermabrasion or with a chemical peel. It is that with the laser skin resurfacing, we're using a computer-generated pattern that provides all these dot patterns onto the skin, and then we layer the laser in multiple crisscross patterns so that it overlaps, and so you don't see those dots. But sometimes what happens is the treatment has been done, the way you heal from it, you might still see the pinpoint patterns, and if you do scarring will then lead to where you can see those pinpoint dot patterns, or if you have hyperpigmentation, you can see those pinpoint patterns that are darker. So that can be a reason why you can see the visible skin patterns. There's treatments that we can do to make sure that that's eliminated. Usually that requires either post-operatively we do a dermabrasion procedure to smooth out all those possible visible skin patterns, or a chemical peel, either one of those. I know it sounds funny that we're using another resurfacing option to treat this, but that's typically what we do to treat that. This occurrence is not predictable, so some patients won't have this pattern at all, and then I will have patients occasionally, the way they respond will have the skin pattern, but there is a treatment for that. Distortion of anatomic features. When this procedure is done, you will have quite a bit of swelling. The swelling is normal and it's expected after the procedure, but it can distort certain areas, particularly around the lips. Your lips will look swollen and you cannot see the visible border of the lips. That's normal after this procedure, after laser resurfacing, or dermabrasion if we do either one there. Damaged skin. So if you've had previous treatment with a chemical peel or a dermabrasion procedure or even another previous laser resurfacing, just know that it can slow down the healing process because you've had previous treatment and the skin is not the same right after that procedure. So if you've had this previous treatment, any of these previous treatments, you'll want to let me know that. Infection I talked about earlier with the viral infection. This is more talking about bacterial infection, and I've already alluded to that. And then scarring, I've also already reviewed that as well, which is the way to avoid scarring is to make sure that the skin heals well, that you don't allow it to dry out, that there's good moisture and there's good ointment on there at all times. Skin contour irregularities. Contour and shape irregularities can occur if this is combined with a procedure like a facelift or an eyelid surgery or something else. So, but these contour irregularities are more with the other procedures and not with CO2 laser resurfacing itself. Skin discoloration or swelling, the bruising or swelling that can occur from the procedure may show up, and you can see that as it goes away, the swelling will go away, and this swelling is normal to see that for up to about 7 to 10 days after the procedure. Skin sensitivity, as your skin heals, you'll have itching, you'll have this itching sensation that is normal. Tenderness or exaggerated responses to hot or cold temperatures is also normal after the procedure. Some people will experience pain beyond that first 1 to 2 days, but that's not usual. The first day is usually when patients will have some burning sensation, and that's it. That's a short-lived time or intensity of the pain. Chronic pain is very rare. Allergic reactions. You could have an allergic reaction to anything you apply on the skin after this procedure, and your skin will be sensitive for the first few weeks after the procedure. So just know that if your skin changes, skincare products you used to use you're more sensitive to them now, that's not abnormal. That's actually pretty common to see that, and so you'll probably want to review your products with me so I can see them, see what is in the ingredients to make sure it's safe for you to use. Drug reactions. You can have a reaction to any medication that we give you, so you also want to let us know, but of course we can't predict what you'll be allergic to before the procedure. Asymmetry. The two sides of the face are not the same, so one may react one way versus the other. Even though we might do the same treatment, the same number of passes, the same number of the dialing of how we've done the procedure, or even if I have done a chemical peel and the same amount of passes with a chemical peel, you could still have one side that treated really well, one side that didn't, and how it responds. Particularly, like let's say the left side, a lot of people have more sun damage on the left side than the right side. So if there are lines that are more persistent on the left side after the procedure, we may need to just go in and do another pass through those areas. Unsatisfactory result. A good result is expected. As long as you follow the instructions, we should expect a good result from this procedure. Where things might be different are how you respond. If you do get hyperpigmentation, that can prolong the healing process. Or if you got redness that lasts longer than the few months that we predict, that can also lead to an unsatisfactory result for you because you're having to deal with the redness. These are all things that we can't predict. In essence, we can't guarantee how you're going to respond to the resurfacing procedure. By experience, I tailor the procedure and the treatment based on the thickness of your skin as well as your skin type. However, how you respond is always going to be up to you. So that part, unfortunately, we can't guarantee. But as long as you follow the instructions, we should expect a good result. And if we need to, I'm very conservative in my treatment. If we need to, we can always go in and repeat some treatments to get to the desired result. So there you have it. That's the risks from this procedure. And of course, if any questions come up during the process of listening to these videos that I've made for you, feel free to reach out to us. That's 805-715-4996, or reach out to our patient care team through the Simplast app by logging in and going to conversations and sending a text through to patient care. Thank you so much.